previously was talking about bioavailability, and I think that leads quite nicely to the next bit, because the other paper that you sort of did was looking at using nanoparticles of albumin to target colorectal cancer. And there were a few changes in the particle themselves. So, for example, you wasn't using PEG anymore. You moved to, I think it was dextran. So it was dextran-coated particles.
Yes.
Why did you decide to make that change from PEG to dextran?
This chapter, we thought about what to do first, but it's true that the strategy we follow for the oral administration, we couldn't use it. I mean, we could, but it wasn't focused for the intravenous administration. Of course, we could use our nanoparticles, oral nanoparticles, with the strategy of the first paper, no, and use it for the anti-tumor studies. But we were a little bit, maybe not reluctant, but we were a little bit aware that what if this bioavailability is not enough to conduct this type of studies now? Because we thought that those nanoparticles, those oral nanoparticles, probably need a little bit more optimization. So it was just the beginning of a chapter that it will continue, but to focus for the tumor accumulation part, because at the end, bevacizumab for us in this part of the oral administration is not just about focusing on bevacizumab. It was just focusing on monoclonal antibodies. How can we encapsulate monoclonal antibodies? And we use as a model bevacizumab because it was well used in our department. There is a lot of studies right now that they are talking about these anti-PEG antibodies. So there are vaccines that they are using PEGs, and now they are considering that some patients, they are creating anti-PEGs antibody and they are reacting to this type of formulation. So of course, PEG could be an alternative, but why not to explore other type of alternatives? So we wanted also something that it could have a status, a GRAS status. And after doing a literature study, we find that dextran could be an alternative also. There are some studies that just dextran, not forming nanoparticles, they could have an enhancement to be accumulating in the tumor, in different type of tumors. Also because it's a polysaccharide. So maybe because that metabolic tumor it's really high, they could just uptake this type of polysaccharide to generate to have more energy in the tumor. Also, dextran is well used in the clinical practice for other type of issues. So yes, why not? And also, dextran could help us to with the stability of our nanoparticles. As I told you before, our strategy was to use different polymeric types to enhance the stability of albumin, and dextrans are commonly used in metal nanoparticles as ion nanoparticles to decrease the aggregation of those type of nanoparticles. So we decided that dextran could be a good alternative to use in the formulation of albumin nanoparticles to also be accumulated in the tumor site.
I see. So you've kind of taken a similar approach of forward thinking again, because if you're seeing antibodies against PEG, then why not use something else as well? So it's a good way of forward thinking and preventing and overcoming that sort of barrier of antibodies against PEG. What did you see overall then when you compare these sort of nanoparticles loaded with your drug, and you compared it to, for example, the drug alone? What impact did it have on the cancer itself?
So we do a quantification directly on the tumor. So when we finish the in vivo efficacy of those nanoparticles, we did a quantification of the bevacizumab amount in the tumor site, and we showed that when we were encapsulating bevacizumab in the dextran-coated albumin nanoparticles, we saw a higher accumulation, that it was greater than 2.5 times greater than free bevacizumab in the tumor. So of course we were seeing that our nanoparticles were helping to have a greater accumulation of bevacizumab in the tumor. Yeah.
Yeah. And did you see, so there was a few things that it spoke about because you measured the growth of the tumor and you did a lot of PET
Yes,
scans as
also.
well. How did the tumor change with the nanoparticle?
So focusing on the tumor growth, we saw that also it was not just about the tumor growth. That of course we see significant differences between the control group and the free bevacizumab compared with the bevacizumab encapsulated in our nanoparticles. But it was more about, we have a parameter that we call it a double time. So how much time do you need to double the size of the tumor? In the case of the when bevacizumab was encapsulated, this this parameter also was reduced. So it was just on how these nanoparticles could decrease also the growth of the tumor in by the time, no, because it was a 30 days essay study.
So you was the time taken for that tumor to double was
Yes,
longer,
the double,
be,
Joe
be,
Sanger.
and that indicates that the formulation was having a greater impact at killing or
Uh-huh.
at least inhibiting that growth.
Yeah.
And I thought it was very interesting because your overall bioavailability was less, but yet the accumulation within the tumor was greater, and
Mhm.
then the tumor growth was slower as well. It was quite
Yes.
interesting.
That's probably because, yeah, indeed, it means that our bioavailability was less, but probably it's because there has been accumulation in other parts. I mean, we were focused on the tumor. Of course, probably is not. I mean, it's specific, but probably there is accumulation in other organs that decrease also that bioavailability. Also, it has to say that the problem, and also why we decided to study bevacizumab and also I mean to encapsulate bevacizumab in nanoparticles, is because with monoclonal antibodies there is an issue of the size and also of the penetration of those monoclonal antibodies, because also they don't the accumulation of the monoclonal antibodies in tumor site is not quite good, let's say. So we need, I mean, we need answers, and we need strategies to enhance that accumulation in the tumor. And it's most, it's because there is the interstitial pressure that it creates the tumor doesn't help to the monoclonal antibody to extravasate to the tumor from the systemic circulation to the tumor. But with the nanoparticles, we have a thing that we call it an EPR effect, enhanced permeability and retention effect. It's an effect that help us to also accumulate more of our, in this case of bevacizumab, in the tumor.
Okay, so the natural pressure within the tumor
Yes,
would prevent the drug
yeah,
from entering, whereas with the
that's it.
nanoparticle, because it's small enough, it can sort of move through
Yeah.
the
Although nanoparticle size are bigger than a monoclonal antibodies, but it's also about the physical form of the monoclonal antibodies and the hydrophilic behavior properties, that they are not facilitate to be accumulated in the tumor site.
I
Mhm,
see.
mhm.
Okay. Uh, there's something you mentioned, this the EPR effect. So that normally means because it keeps the drug in the circulation for longer and allows the tumor more opportunity to absorb that particle. I'm not sure if you've measured this, and so I'm just going to ask, did you measure sort of like the elimination time of the antibody compared to the particle?
No, we didn't.
Okay.
What a pity.